Hi everyone, this is Julie from Totally Holistic Health and welcome to Therapy Top Tips Tuesday. And today we're going to talk about fear. A lot of people have had issues with spiders in their house recently, so I did promise I would do this one for a few people who are having issues, and obviously just to help alleviate that fear of spiders. It's a really simple technique. Now the thing you need to remember is it is a kinesiology technique, so really this may work or it may not, but really this is down to how the fear actually manifests itself. This one is actually a tapping technique. We're actually using the stomach meridian to tap on a particular point. So you tend to find that most people tend to have around about sort of at least seven fears or phobias in their lives, and a phobia basically is an irrational fear of that tends to limit ability to sort of enjoy our lives basically. So spiders could actually be one of them, but obviously if it's not an irrational fear, or it's more of a known reason why, then this technique probably won't. But if it's an irrational fear like spiders possibly, then this will probably work for you. So 80% of phobias tend to affect the stomach meridian. So what tends to happen is if you have an over energy in a particular meridian, what you normally need to do is actually sort of draw the energy out of that meridian to help sort of level up the energy systems in the body. This one in particular though, we actually have to over energize a particular meridian to really sort of help alleviate that fears, and basically almost like blast that energy into it to basically help just blast through that sort of that energy, that fear response. So what we need to do is find a point on our eyes. So it's actually just underneath the eyes basically. So if you just go around to the eye socket, it's underneath the eyes, feel it down here, you should feel a little bit on the bone, you should feel a little nick. It's like a little V-shaped nick just in the bone of the eye socket, and that's the stomach 1 point. So it's actually the start of the stomach meridian. Okay, so if you do it on both eyes, you should be able to find it on both eyes, which is around about there. It's just directly underneath the iris. Okay, so that's your stomach 1 point that we need to tap. Obviously it's probably best to have your eyes closed in case you poke your eyes out. So what we need to do is we need to actually concentrate on that fear. Now I know if it's a phobia, people tend to sort of try to not focus on that particular fear, and I actually use this when I was actually in training. I actually use this point and it's really useful, and I have a fear of spiders. My brother, when I was little, used to just hang spiders in front of my face, and I actually woke up once with a spider on my pillow, so it was like so every time I used to see a spider it was like, oh my god, I used to go totally into apoplectic shock. But using this technique, what we do is we actually think about what that fear is. So obviously in my case it was spiders. And what I did first of all, I mean normally we would use kinesiology testing to see whether this would actually work, and it did on me. So again, if it's not as effective, obviously then maybe worth coming to see me as well for a chat. But I actually thought about maybe having a spider in the room, and then and I was seeing how I actually responded using the kinesiology testing. And then I had, we were actually on the massager's couches at the time, so I had this sort of this thought of maybe a spider crawling up the massage couch leg, and the response I was getting from that. And basically by tapping these points at the same time as actually thinking about the fear, it really did help alleviate it. So what you really need to do is actually, rather than not think about it, you need to think about the spider or whatever your fear is. So if you're just tapping away at that particular point, and then maybe just sort of think about how would you feel if you had a spider in the room. Just really concentrate on those fear feelings, and like what that sensation would be if you actually saw a spider, how you would actually respond to it, and just keep tapping on that for about 20 to 30 seconds. Again, just seeing how you feel. So then just to basically evaluate how you feel now. Okay, so would you be okay with that spider in the room? Okay, now maybe what would happen if that spider was maybe sort of slightly closer to you? I wouldn't go as far as you maybe actually touching it, but basically it will take that fear response away from you. So again, just keep tapping on it, and basically just sort of changing that thought. So once you've actually got one layer of that thought, the actual thought of actually having a spider in the room, then maybe sort of having one a little bit closer, or having it darting across the floor, that sort of thing, when you finally see it and then then it disappears. And just all those little fears that you can actually feel at the same time, just keep tapping away on that point. And what you'll actually find is, I know with me when I had it done, I was actually sort of saying, okay, I can deal with the spider in the room. I was actually no problems with that. I was dealing with the spider actually crawling out the massage couch. I think it was a little bit sort of like anywhere near me, but that absolute terror really, really helped. Now, it's not going to be something that's going to sort of probably stay every time you do see a spider. You probably will need to tap on that point, but it's a really, really useful point just to tap. I mean, people might be wondering what you're doing, but it's really useful. So again, really, really experience that thought, that sort of feeling you actually get when you're actually seeing a spider, or whatever that fear or phobia is. Just try concentrating on it, and basically that will over-energize the stomach meridian, and then what we're trying to do is blast our way through it. So the more you think about it, the actual more effective it is. If it doesn't work, as I said, it's possibly not what you actually need, and there might be some other techniques that would actually be beneficial for you, and obviously which case then maybe just give me a quick ring and we can maybe sort something out and maybe come and see you for a proper kinesiology treatment. But as an interim temporary treatment, hopefully that should work. So until next week, see you soon. Bye.